Hey everyone, I just wanted to make this little video to break down some of my findings from my internship project this summer. This will basically be the Spark Notes version of about 3 interviews that I had that ranged from roughly 30 to 40 minutes over the course of the last few weeks. And so the first question to address this, I would like to say, the grand challenge chosen. For this project, I chose the grand challenge to close the health gap. And specifically within that challenge, I focused on priority number 5, which is to foster the development of an interprofessional healthcare workforce. And so just going off that, from the Grand Challenge website, there's a note saying, according to the Bureau of Labor Statistics, the demand for social work healthcare workforce will outpace that for all other occupations. Between 20 Hey everyone, I just wanted to make this little video to break down some of my findings from my internship project this summer. This will basically be the Spark Notes version of about 3 interviews that I had that ranged from roughly 30 to 40 minutes over the course of the last few weeks. And so the first question to address this, I would like to say, the grand challenge chosen. For this project, I chose the grand challenge to close the health gap. And specifically within that challenge, I focused on priority number 5, which is to foster the development of an interprofessional healthcare workforce. And so just going off that, from the Grand Challenge website, there's a note saying, according to the Bureau of Labor Statistics, the demand for social work healthcare workforce will outpace that for all other occupations. Between 2014 and 2024, employment of healthcare social workers is projected to grow by 12%. And employment of mental health and substance abuse social workers is projected to grow by 19%. Social work can lead integrated initiatives for evidence-based workforce development by reviewing practitioner preparation for transdisciplinary social interventions, defining a core curriculum for these initiatives, establishing training standards for advanced practice in specialized areas, and identifying new competence areas for the emerging health system. For example, prevention science, place and settings-based research, community engagement, improvement science, analytics, and team methods for collaborative behavioral and physical health care. And before jumping into the second question I'd like to address in this short video, I just wanted to relay some of the major findings from the World Health Organization's Framework for Action on Interprofessional Education and Collaborative Practice. This came out in 2010, and it was really a pretty instrumental part of this whole project, because a lot of the conclusions that I've reached through my interviews, as well as with the research leading up to these interviews, that helped sort of guide the questions and the development of the structure I was working towards, came from this report. And so just a few of these. And so basically the example of interprofessional education is when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. And then furthering that, this type of education is essential to preparing a collaborative ready workforce. So basically, without training these students from day one throughout their undergraduate and graduate careers, we will not be able to piece together the workforce that we need right when they step out. And that's really a defining theme throughout this project. And then, here we go. And then basically this is something that as social workers we all know, but it's also why social workers are so important to these workforces. Collaborative practice strengthens health systems and improves health outcomes. We all know this. We work collaboratively within the social work profession, referring clients and stuff like that, and we all have sort of our own specialty areas that we focus in. But especially when we extend outside of our own profession, that's where we can really get the best outcomes for the clients, and so that's what interprofessional teams are solely focused on. And then so moving on from that a little bit, this was a part I found interesting from this report. It says, effective interprofessional education fosters respect among the health professions, eliminates harmful stereotypes, and invokes a patient-centered ethic in practice. And so I think we've all sort of come to grips with the fact that many people don't know what social workers are capable of, um, and some might look down on us if they're physicians or nurses or something along those lines. But I thought that was interesting because when you do really effective interprofessional teams and folks are trained in a way that allows them to really recognize the strengths of each profession, you're going to get more mutual respect versus the where everyone kind of holes into their own profession and is hesitant to reach out to other professions and areas and specialties that might be able to have a little bit stronger results. And then this, continuing on that, says, moreover, the profession must articulate clear, consistent messages about how social workers can identify and meet these needs, especially as a part of a transdisciplinary healthcare team. And that's something that's going to be a common thread throughout all 3 interviews I had. And so I'll save that for a few questions down the road, but I just wanted to give that brief introduction. For the second challenge, why was this grand challenge selected? Well, as everyone pretty much knows by now, I'm interning with the National Association of Social Workers Illinois chapter. And with that, we're involved in a lot of workforces and task forces and just different collaborative efforts throughout the state. And especially being located in Chicago and in the summer where it's a bit of a downtime for a lot of political action and things like that, I've been invited to attend a handful of meetings. And most of these meetings, I don't know if it was intentional by my supervisor, Joel Rubin, or if it was just sort of by chance, but a lot of them focus on healthcare. Specifically, I went to meetings for the Children's Mental Health Partnership, Mental Health Summit, and also some meetings that focused on bridging the gap between primary care and behavioral health care. So this project really fit in nicely with those goals, and so that's one of the reasons that Joel suggested this would be one of the routes I take for the Grand Challenge selected. Additionally, NASW Illinois has been working on a workforce development initiative, and that started with a summit that took place on April 20th earlier this year. And after that, we've really been wrestling with where do we go from here, how do we take what we've learned through that initial meeting. And that initial meeting featured a handful of employers around the Chicagoland area who hire emerging social workers, and then field directors and deans from schools of social work throughout the state. And so we really wanted to transform what we learned at that meeting and build upon it moving forward. And so that's really the thread between this. It's a mix of what I've been doing since joining NASW, and as well as where NASW is looking to get feedback and build upon in the coming months after I leave with my internship. So this project, I'm really hoping to take what I've learned and just relay those to the stakeholders involved. So for the third question here, I would like to address the design of this project as well as what my conclusions were at the end of it. And so basically what I did was I researched all about interprofessional health teams. I looked on the Grand Challenge website, I dove into some scholarly journals, and I basically wanted to know more about the issue. And so once I got most of the preliminary research out of the way, I started to design some interview questions. And so these ranged from where do you work, what's your experience at working with interns or emerging social workers, so those are folks who are 1 to 3 years out of school, in my own personal definition. And then I just asked them some things about like, what are the trends you're seeing with these emerging social workers? And I knew a few of them from reading about and listening to our video that we did at the Workforce Development Initiative. But I just wanted to ask a few more of those questions, and then also just, what are ways we can work towards an interprofessional healthcare workforce, and then where are we falling short, what are we exceeding in, and then as well just how they think emerging social workers can fit in this team, are they prepared, and so there were roughly about, I'd say 12 to 15 questions, and I can link to my question sheet as well as the findings and more substantive explanations of all the answers each participant gave. But just for this part of the video, I really want to keep it short, and I just wanted to focus on some of the dominant themes that I saw throughout all 3 interviews. And so first, I guess it's probably important to mention who I interviewed. So I interviewed 3 directors in the healthcare field, all coming from a little bit different. I interviewed the director of a large healthcare provider, the director who's a social worker who's over at a hospital overseeing some of their programs, and then the director of someone who works with older aging folks, specifically ways that they can live at home, and it's more of a corporate focus. But throughout these 3 interviews, each of them coming from a little bit different background, they really hit on a lot of the same things. There were a few that stuck out, but I limited it down to 5 dominant themes that I saw throughout all 3 interviews. And so the first one that was sort of upsetting to me as an emerging social worker was they all touched on professionalism, the importance of it, and also the lack of it that they're observing with the younger folks. And some of this is a generational difference. We tend to do things a little bit differently than maybe some of our older colleagues would. But that was really upsetting when I heard things like emerging social workers don't dress, professionally. They don't communicate professionally, whether that's through email or that's in the office. And just their behavior in general, being on their phones, things like that. And that all connects to the larger social work profession. And I think it's doing a disservice to those who are really working to be the most professional and the best social workers they can be, and so that was a little disheartening. Secondly, I heard multiple times that schools need to really emphasize program development, financial literacy, and instead of focusing on more of the statistical side of research, really focusing on the practical skills, just doing stuff in Excel, things like that, so these students are really prepared when they enter. Because while if you're going on to get a PhD, some of the SPSS knowledge is super helpful, for a lot of people who aren't, it's really about knowing the finer details of Excel, how to build a program, and then how to evaluate your own program. Thirdly, exposure to non-traditional settings. This was touched on, especially when I tried to bridge the work from what are emerging social workers doing to how can we prepare them to join these interprofessional teams. And that was consistently, like, maybe if we can get some practicum experiences that are not the traditional route, they're a little bit different. Maybe they're in a non-clinical setting. Maybe they're in a place that the school hasn't branched out to before. Fourth, social workers communicating their value to other professionals and just in these interprofessional teams. I heard that over and over again, that social workers, while we advocate well for clients, we're not always willing to say, this is what our profession is good at, this is what myself is good at, and this is how I fit in this team, and this is why I deserve to be on these teams and involved in the decision-making process. In the professional settings, those are what a lot of folks have been saying, and so I think we really have to learn how to better advocate for ourselves. And then just overall the importance of these interprofessional teams, and especially having social workers on these teams, which was really good to hear considering that's the focus of this grand challenge. All 3 folks mentioned that social workers can see the person and environment. That's what we're trained to do. That's what so much of our schooling entails, versus other professions might just see an issue or a physical ailment and they immediately think, this is how I'm going to treat this, only focusing on the physical issue or the medical issue, whereas social workers would consider a lot of things about their environment, some stress factors, what's their home life like, what's their neighborhood like, are they getting enough to eat, do they have enough money to do other things, and so that was an important piece, and I want to touch on that a little bit further moving forward. Moving on from some of the early findings, I just thought about what are some of the next steps that I think the profession and all the stakeholders involved could do moving forward to really hit the grand challenge of fostering that interprofessional healthcare workforce. And so one of the things I was thinking about is just more opportunities and more guidance for professional development. Things like networking events, sort of like CEU trainings, although we're not licensed so we wouldn't get CEUs, but just some of those